People with depression and other mental health issues are encouraged to ask for help, to get treatment and support. And there are various treatments available, at least in theory. In reality, though, how accessible are they in Ontario? I got insight into access, wait times, and the state of our system from Camille Kenville, CEO of the Canadian Mental Health Association Ontario Division. Camille, how are you doing?
I'm great. Nice to be with you.
It's awesome that you can be here with us to talk about it. I want to talk big picture first. How would you characterize the level of access for people in this province when it comes to mental health services?
Not really as good as it could or should be. There is a lot of work happening to make it better. We are working with multiple partners across both the hospital sector, primary care, partners, and other nonprofit organizations, all of us trying to collaborate and find ways to make sure that people are getting the services that they need. And we are, I would say, not nearly as coordinated as we could be on the ground. Probably difficult for people to navigate and find the kind of care they need. We're very cognizant of that and really very interested in ensuring that people know and understand that the community-based system is there to serve them and that we are very interested in keeping them out of emergency departments and even out of their doctor's office and we can provide the kind of support that they likely need directly without having to access those other two groups.
When it comes to closing the gap, to what extent is it about resourcing and funding versus sort of the overall design and efficiency of the system?
Well, it's a little bit of all of that mix if you want the truth. So the design of the system is one in which we're not linking as efficiently as we might be able to. And I think again, there's a lot of effort and energy happening on the primary care front, and that is without question where we need to make sure community is connected. The vast majority of people who are looking for support are going to their family physician if they have one, and ideally, they are getting a referral to a community-based provider, or they're getting some kind of care or treatment through that individual. But at the end of the day, it is a fractured system in the sense that we have multiple providers and not necessarily the means to help people get to the exact kind of care they need. And obviously, out of the worst case scenario, which is sitting in an emergency department.
Camille, so you had mentioned primary care doctors. As we know, not everyone in this province has access to a primary care doctor. It seems like is that the first place people should be going if they are struggling?
Well, to be honest, hopefully not. Hopefully, there is an ability to navigate into community and to a provider on the ground. There is also the Ontario Structured Psychotherapy Program, which for many, many people who have mild to moderate issues are able to access and receive services entirely free of charge. It is a fantastic program that gives great accessibility. People can access it as they wish. They learn cognitive behavioral therapy skills. These are skills they can use throughout their lifetime. Anything we can do to really reduce the burden on the acute care system is always our goal in community, and to provide the kind of services and resources that people need to stay out of doctors' offices even.
There are a whole new suite of cutting edge technology for depression and anxiety, and there's a lot of excitement around it. In our previous interview, psychiatrist Roger McIntyre said he's the most hopeful he's ever been in his 3-decade career. Do you share that same optimism?
I am incredibly enthusiastic about what's happening in the mental health and addictions world, and particularly in mental health, where we're seeing, as you point out, new treatments and new methods in which people can get the help and support that they need. We've really suffered with stigma for a very long time in this, not only in terms of how people either avoid seeking treatment and suffer silently, or really not having the investments to be able to make these kinds of new modalities and serving people available. So it is an incredibly exciting time. It's fun to talk to psychiatrists and others who have a renewed joy with their work. And we're seeing places like Sunnybrook, the Gary Hurwitz Brain Sciences program, which I recently had the chance to have a look at. And it is so wonderful to see physical health care and mental health care coming together into one space where there's no stigma and people can come in and get the kind of care they need in the same way that you would access needing an MRI or any of those kinds of treatments. And that is leading edge and so forward thinking, and it's really wonderfully exciting for all of us who have spent a lot of time in their career in mental health.
When you talk about access, we do have to talk about costs. And I am curious, some of these treatments, such as ketamine for depression, can be administered in just a few sessions. I am curious, are they potentially less expensive than any other forms of treatment?
Well, the treatments that frankly we are most familiar with in community are services that are available to individuals in group sessions and one-on-one sessions and in ways that avoid having to go the treatment resistant route, which ketamine serves. So our world is slightly different in the sense that we're really working one on one with individuals. We provide case management. We provide services to individuals with very serious and persistent mental illness through supports that really meet them where they're at. And so the medical world will manage ketamine and be able to provide those services and ideally bring people out of what has been a long journey as they have been treatment resistant.
Now, we have these new treatments, of course, early days for some of these, but do people in this province have proper access to them? Of course, there's lots of excitement, and people are probably itching to kind of see, is this something that will be suitable for them? But will they have access to it?
Well, that is a very good question. And quite honestly, we have gaps throughout the system and we have geographical gaps as well. And it does look different depending on where you are in the province. So this is something that we routinely advocate for, not just in terms of these unique and new emerging modalities and technologies in some cases, but really for everyday services that people need to access, whether it's you know, the ability to have a home through supportive housing, the ability to get the kind of care and treatment for bipolar issues, depression, all of these things. Um, we really would like a level playing field across this province where anybody who is diagnosed knows exactly what they can expect in terms of their treatment, in terms of their trajectory within the system. There's great progress being made in building standards around some of this work, and we're happy to be part of that, but we've got a long way to go.
With that, what's one recommendation that you have that could improve access in general to mental health services in this province?
Well, it's hard to really think about one, but I have an obvious bias towards the community-based system. I think as I travel the province and visit with our 27 branches and I see what's happening on the ground, it is really in some ways the heart and soul of the system. And if we can put energy and resources into my colleagues who are doing the incredibly difficult work of serving the homeless, serving people who have very serious illnesses, including young people, including individuals who have been disenfranchised for various reasons, some who have addictions. If we could put the resources there where it's much more efficient to keep them stable and ideally on their medication and outside of the acute care system, saving those resources are really important for those who need that level of care. And I think we could just be doing a great deal more in community. And I know my colleagues would ideally love to see much of their work expand.
We're going to leave it there, Camille. Thank you so much for your insights. Really appreciate you joining us on the rundown.
It's been my pleasure. Thank you.